Meeting
two
is being recorded.
two granddaughters, and this will be my first grandson. So I'm really excited.
That's amazing. What a blessing. So
Yeah,
congratulations.
yes. All right, so you're recording this,
I'm
so I can get a
recording
copy of
this,
it.
and then we'll be able to give you a copy of it as well too. And we'll just hop into it, and then we'll hopefully have some of the media guys just kind of like turn it into stuff that we can use as far as marketing and stuff goes too.
Yeah, and I would love to get copies of all that so we can use
Yep.
it well, and I'll try to do it without too many mess ups.
No, you're good. Just be
Okay.
yourself.
All right.
All right. So, welcome everybody. And today I have the privilege of meeting with Mark Rohr, CEO of Trinity Medical Solutions. Mark, thanks for hopping on today. I know you're a really busy guy, and I just appreciate your time. So good to have you. And I had the pleasure of meeting Mark earlier, and we talked a lot on the phone, and we've been communicating for the last several weeks, just getting to know him and the Restore EMS Chair that we are introducing, and so excited to bring to the greater Philadelphia area. And so today, Mark, I just wanted to have a chance to let everyone else hear kind of your story, what this chair does, the revolutionary protocols that we're going to be able to bring to this area and help so many people who are in need of this therapy. So we're really excited about that. If for people who have never heard of you or your company, can you just briefly just give us your background, introduce like who you are, what Trinity Medical Solutions does, and give us just an idea of what you guys are about.
Okay, Dr. Newman, thank you for having me, and I'm really excited for you to offer this technology as well. I mean, I've been in the aesthetic laser industry for 30 years, and when you change somebody's appearance, that's great. When you change somebody's weak pelvic floor condition and you give them a whole new lease on life, that changes their life. I'm all about this chair, and for those of you who don't know me, I'm Mark Rohr. I've spent 30 years in the aesthetic laser industry, and I founded two successful companies. The first one was Sandstone Medical Technologies, which started back in 2000 and 2012. Elman Cynosure is one of the largest laser companies in the world. They purchased that company from me, and I worked for those guys for 2 years. I had a 2-year contract with them, and so in 2014 I left Cynosure, and I had a 1-year non-compete, and then I introduced a company called Rohr Aesthetics, and I was very fortunate with that company as well, very blessed, and that company grew into a multi-million-dollar company as well. And in 2022, private equity knocked on our door, offered me a lot of money for my company, and I sold that company as well. And I was 57 at the time, and I really thought, they wanted me to sign a 3-year contract. In 3 years, I'll be ready to retire. I'll be almost 60, and that was in March of 2025. And turns out I wasn't ready to retire. So I decided I wanted to start a third company, and I wanted to do something different. I wanted to deliver affordable, gold standard technology that can improve, a person's quality of life, and at the same time, as you all know, as a physician, you know that capital equipment is expensive. I wanted to provide the technology so that you could acquire it at an affordable price, and at the same time, offer it to your patients at an affordable price. And I started looking around, and that's when I discovered that there are 30 million people in the U.S. who suffer from weak pelvic floor issues like urinary leakage. It's a common problem, but many people don't know where to turn, and they don't feel comfortable seeking help. And that's one reason why I founded Trinity Medical Solutions, and why we developed the Restore EMS Chair. I wanted to make public health care more accessible, more affordable, and less intimidating. And the big message I want people to hear is, you're not alone. Millions of people have, just about anybody over 40 has a weak pelvic floor issue, and there are some real options out there.
Yeah, awesome. Thank you for sharing that. And we see that in our office. We've seen this issue not only relating to what you have already alluded to as far as incontinence, and which is obviously a real problem, but also in what we do is a lot of back pain and some other issues as well, even in the upper cervical work we do. And so that really intrigued me when we connected. And when we looked further into this technology, it was just a no-brainer. For those who don't know, could you share a little bit as far as like you already talked about how many people have it, and how common it is, not just, and I think not just women, but men as well. But what are some of the signs that someone may have a weak pelvic floor and not even realize it's actually coming from the pelvic floor?
Yeah, and I would say weak pelvic floor issues is far more common than most people realize, and that's part of why we need to talk about this more openly. Pelvic floor dysfunction affects people across many ages and many life stages. It affects young women who maybe had a child and they have incontinence issues. Women who go through menopause, they have incontinence issues. Aging men, as we age, incontinence is an issue for men as well. And then men who've had prostate treatments, they all have weak pelvic floor issues. And because it's not discussed much, people assume it's rare or it's just something that they have to live with. You don't have to live with it. It's a common problem and it is treatable.
Yeah, absolutely. And some people maybe are embarrassed to have a stigma and understandably, due to some of these symptoms, around it. But why do you think it's not as talked about much from the medical side, right? Why is there not much awareness brought out to it currently?
I think part of that is, and you mentioned it, it's embarrassment. There's fear. There's misinformation, and quite frankly, I mean, people have busy lives, and if they're a young mom, they're busy taking care of their children. If or maybe they're taking care of older parent, and they just don't find time to themselves to recognize the symptoms, and they just accept it as normal, as the new norm.
So as far as this modality, we're going to talk a little bit more about the Restore chair because I'm really excited about this technology. But from what you've seen in the weak pelvic floor, talk a little bit about how this affects someone's life, right? Day in and day out, what you've noticed, what the people who are using and this modality to treat pelvic floor, if it's not treated, how is this impacting people's lives and the conditions?
Okay, well, first of all, when people have pelvic floor issues, they lose their confidence, they lose their self-esteem, they will kind of just close into themselves, and they'll just become isolated because they're embarrassed. They don't want to go out to dinner. They don't want to go to a social event just because they can leak just sliding in and out of the car. So it affects their daily life when they're having to figure out where the nearest bathroom is going to be, when they start contemplating about where their next bathroom break is going to be. So it affects their daily life. And if it's not treated, it just gets worse.
Yeah, and even to touch upon that, we've seen it like, hey, go to a movie. I got to sit near the aisle because I know I'm going to have to, run out. Or, we have a lot of people who are athletes, and it's like, hey, if I know I'm lifting a certain day, like I got to wear certain clothes because I know I'm going to leak. And that just again talks about confidence, talks about interference, embarrassment. A bigger issue, than what most people think. I didn't really understand the context until we really dove into it a little bit more. So, we see it a lot. And right now, what are the traditional treatments people are typically, trying first, and where do they fall short?
Okay, and I will tell you, let's talk about some of the obvious signs first. Some obvious signs are when you cough, when you sneeze, when you laugh, or lift a child. If you leak a little bit, that's a common sign. Other common signs include, the sudden urgency to go to the bathroom more than you used to, or where you're waking up more in the middle of the night than you used to go to the bathroom. I think a lot of people think that this is just normal, but it's all signs of a weak pelvic floor. And I think people, they're waiting uh, just because of embarrassment, fear, and the misinformation.
And so typically, if you get people to even talk about it, right? And I've read stats that's up to 60% of people won't even bring it up. Let's
Right.
talk about the other 40% that are bringing it up. What options are they given right now? Minus this one that we're going to talk about.
Okay, so you can look at one of the main things that you'll hear about, do Kegels, okay? And Kegels, that's something you can do at home, and it works for some people. It doesn't work for others, and that's mainly because a lot of times Kegels aren't done right. Uh, uh, no one wants to take the time out to do the Kegels, and the other options are you can take medicine for it, but again, there's side effects associated with the medicine, and you can also have surgery. You can have a surgical sling. So, but then when you do that, then there's anesthesia involved, there's complications involved, there's downtime involved, and the Restore chair, the EMS chair that we're going to talk about shortly, this is just a breath of fresh air because it's a non-invasive way to address a really big problem.
So a good segue right there, Mark. I mean, perfect transition right here for people who have not heard about the EMS pelvic floor therapy or just hearing about it now. What is it? How does it work?
Okay, so the EMS chair stands for electromagnetic stimulation, and the way it's going to work is we're going to send thousands of contractions into the pelvic floor region, and it's going to be like doing 15,000 Kegels in a 28-minute procedure. Okay, so we're going to twist, we're going to stretch, we're going to flex the muscles, and what we want to try to do is create muscle confusion because we don't want to just send out one waveform. We want to create muscle confusion so the muscles don't plateau and they'll continue to get stronger.
So basically, it's just a chair that people come sit on, right? You don't have to disrobe, sit fully clothed, and you just literally sit on it and let the chair send some stimulation to the nerves in the muscle to cause them to work rather than you manually doing it. Is that a fair assessment right there?
That is a very fair assessment, and it's a 28-minute procedure, and we're going to build the strength and control in the pelvic floor region. And most surprisingly, everybody thinks when they hear about treating the pelvic floor region that it's going to be invasive and there could be some pain associated with it. That's the beautiful thing about this is no one disrobes. They sit on the chair for approximately 28 minutes. They can watch a movie on their phone or on an iPad. They can read a book. They can shop on their phone. It's just a 28-minute procedure with little to no discomfort, and the results with it are amazing.
So what does it feel like if someone's thinking like, okay, what should I expect? What does it feel like for someone to actually sit and receive this therapy? Does it hurt? Do they notice anything? Is there any downtime afterwards?
Okay, that's a great question. And just so everybody knows, this device the Restore chair is FDA-cleared to strengthen the pelvic floor muscles and for the treatment of urinary incontinence in both male and female patients. So you sit on the procedure. It's a very simple procedure. There is no discomfort, and basically it's like doing, like I said, 15,000 Kegels in a 30-minute session. And when they're done, it's just routine maintenance. They get up, they leave, and go on with their daily routine.
That seems pretty easy.
Yeah.
Yeah. And that's the beautiful thing about it, right?
This device, it is such a simple, easy procedure, but it is life-changing.
Talk a little bit about the results that we've already seen with, some of this, like you're saying, what kind of success rates are we seeing? What kind of changes are we seeing? How fast is it to take for someone to see these results?
Okay, and that's a great question. So we recommend 6 treatments, and those 6 treatments are done over a 3-week period. So in 21 days, it's 2 treatments a week for 3 weeks. So you'll know in 21 days whether the treatment worked or not. And I will tell you, 95% of, and we talk to patients and we talk to clinicians who've been using the chair. 95% of the patients who follow through with the 6 treatments report a marked improvement. You will start to see some improvement halfway through the series of 6. Usually on the, we'll say 2 to 4 treatments, they're going to notice that their bathroom breaks are getting longer, and you will start seeing the treatments usually within, like I said, the first week or 2. But if you do the full series of 6, that's when you're really going to see the best treatments. And just so you know, it's like doing sit-ups. If we do sit-ups, we can get a flat tummy. If we quit doing them, it's going to go right back. So in a 3-week period, we can get rid of the majority of all incontinence issues, okay, that someone's having. But with that being said, they will need a maintenance treatment, and the maintenance treatments are just once a month. So you come in once a month, you sit on the chair for 28 minutes, and you'll maintain the results that we got from doing the series of 6.
That's awesome. There are other options, right? There's other companies that are offering similar stuff. Can you touch a little bit about, why the Restore chair, right? I mean, I know that we're manufactured in the United States, which is huge for me, right? I know
Right.
we're FDA cleared for men and women, which is a huge advantage as well. But I know that there's some differences in, like you talked about, the technology in there as well. If people are considering other options, whether they're buying them on Amazon or going to another office that doesn't have the Restore, touch a little bit about why it's important for this technology.
Okay. First of all, I would never recommend that somebody buy a chair off Amazon to use for this procedure. Ours is FDA cleared, and even though the ones on Amazon are really, 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 really affordable, that's really all you know is that it's that those are really affordable price. And I hate to use the word cheap, but they're at a really discounted price. You don't know anything about them. You don't know if they're calibrated properly. You don't know if when's the last time they were calibrated. Other than knowing that there was an affordable price, you don't know anything. Chances are it's not FDA cleared, and ours is one of the few. There's only 5 that are FDA cleared, and ours is one of the 5. And I always ask when somebody asks me about the ones that are on Amazon or on Alibaba, you know what? Would you want a device used on your wife or your daughter or your mother or your husband that all you know about is that it's not FDA cleared and that it was cheap? I don't think so. But we put a lot of and there are several devices out there on the market that, like I said, there's 5 that are FDA cleared. Ours was the 5th one, and ours is a little bit unique and a little bit different. Okay, so inside all the chairs is a magnetic coil. Okay, and that's what's creating the energy. Okay, and as the chair's used, that coil heats up. Okay, so you have to figure out how you're going to keep the coil cool. If you don't, it's going to make the seat that the patient's sitting on hot, and it's going to become uncomfortable. Okay, so all the other 4 chair manufacturers, with the exception of Trinity, they use fans. They blow air on the coil to keep it cool, and it's fine to do it that way. Well, with my laser background, we always cooled our laser coils with water. So I decided I was going to make my chair. If I'm going to make something, I want to make it the best I can. We decided to cool our magnetic coil with water. We're the only liquid cooled coil in the industry. And we cool ours with water. And not only does it cut down the noise compared to the other devices that use fans, but more importantly, I believe our chair gives us a little bit better treatment because we can put our treatment coil, we don't generate any heat at all. We can put our treatment coil right up to the treatment area, to the perineal area, and we don't have any heat at all. Whereas where our competition or some of the other manufacturers, if they were to put their coil right up to the treatment area, they would still heat the chair up. They're not going to burn anybody, but they could make it where the procedure wasn't quite as comfortable. So what they do is they pull their coil back a few inches so that they defocus the energy. It's kind of like if you have a flashlight, if you get the light real bright, real close to the wall or to your hand, it's real bright and intense. And then as you pull back, the light defocuses. That's kind of how our chair is working. Because ours is water cooled, we can put our treatment coil right up to the treatment area and we don't generate any heat. The other companies, they pull back just a few inches to defocus their energy so that they're not going to make the treatment uncomfortable. And that's why I think we get a little bit more focused energy and a little bit better treatment with our chair than you're going to get with some of the other ones.
And I've also read because of that too, a little bit more comfortable as far as sensation, as far as getting those treatments. Now you talked about the different wavelengths and different pulses that they're able to produce to confuse the muscle. I think that you said, right? Is that across all 5, or is this unique to the Restore as well?
Yeah, I will tell you that most of the companies do alternate their frequencies just to create the muscle confusion, and that's something that if the chair's not doing that, I'm not going to say their chairs don't work because they all work, but by creating muscle confusion, you can get up to 35% more muscle mass out of the muscles.
Some of these other devices that you see that aren't from the chair, like the home ones or that you do yourself, probably don't do that. And I wanted to touch upon that too. Not just the fact of, hey, like the FDA hasn't cleared this device and make sure it's safe to use, correct?
That is correct. And some of the ones that are FDA cleared for home use, and I'm not familiar with any EMS chairs that are, but if there are some out there, ours puts out 2 Tesla of energy. That's electromagnetic energy is measured in Tesla. That's a lot of energy. Okay, the FDA is not going to approve something. I don't believe that they would clear a device for home treatment that was that powerful. Correct. So if there are some out there that are for home use, they're not going to be as powerful.
Yeah, absolutely. So I know that you're short on time. I just have 2 more questions for you. Just as really for the viewer who's considering this, what do you typically see people's response are after they do maybe 1 or like a couple of the treatments or even the series? What has been the response? I know you mentioned the high clinical 95% success rate, but like what do you see when people get off the chair? Typically, what do they typically say, after that, initial treatment especially?
Okay, well, first of all, after they've done their series of 6 treatments, they're amazed at the improvement in their leakage. They're amazed at the improvement of their urgency. They're amazed that they're not using pads. They're not wearing diapers anymore. And they're also just amazed at their quality of life, how much better it is. And of course, the results are going to vary from patient to patient. And I'm talking about 6 treatments. Some patients are going to be fine after 4 treatments. Some of them may need 8 treatments. I've never known anybody to need more than 8 treatments, but 6 is usually enough. And what I hear about most of the time when they're after they've completed their series is there's really 2 things. I hear I don't realize how much mental energy I was spending planning my life around bathroom breaks or worrying about leaks. And the other one, which is a close second that I hear, is I expected the treatment to be uncomfortable and more invasive. Instead, I got to stay fully clothed. It was a comfortable procedure, and I'm just amazed at the results.
Yeah, and that's, I think, huge now. It's got to be convenient. It's got to show results, right? It's got to be effective quickly and safe. And I think this checks all the boxes, which was so intriguing for us at our office because, as chiropractors in our office, we're treating the musculoskeletal component, and this is actually affecting the nerve that actually controls the muscles, right? So that fits in our wheelhouse. And, unrelated back pain that doesn't resolve sometimes can be a pelvic floor issue. We haven't even talked about prolapse, right, due to weak pelvic floors or sexual dysfunction in men and women, right? And so these are other benefits that you'll maybe see improved because pelvic floor is kind of like the base of your core right here. That can control all these other things. So a lot of potential for this therapy, which is why we're really excited to roll it out. We're rolling ours out the beginning of March. So we're super excited to bring it into the greater Philadelphia area. Last question for you, Mark. If someone's watching this and they think, hey, maybe this is for me, I'm not sure, or they're embarrassed, or to bring it up, what would you suggest or encourage them to do to take the first step in finding out for this?
Okay, and I'm going to answer that question just a minute, but you mentioned all the different issues you can have with weak pelvic floors. One thing that I want to mention is no one wants to talk about urinary incontinence. They sure don't want to talk about fecal incontinence, okay?
Oh, yeah.
And that's another thing that is caused by weak pelvic floor. And if somebody, to answer your question, if they're embarrassed, this is what I would tell them. I would tell them, you don't have to be embarrassed. This is an incredibly common issue, and it's talked about at clinics every day. You're not the only one who's having these issues. And most importantly, I want you to know you are not broken. The first steps, it's just as simple as having a private conversation with someone like Dr. Newman. If it turns out you're a good candidate for the EMS chair treatment, the Restore chair treatment, that's great. You're going to get a non-invasive path that doesn't involve any type of surgery or any downtime. And if it turns out you're not a candidate for the EMS treatment, you know what? You're still going to walk away with clarity, and you're going to have a plan. So either way, you deserve to feel confident in your body again.
Absolutely. I mean, and I would even add to that, just thinking about that question as well, it's no different than having a weak heart, right? I mean, you can't control certain areas in your musculoskeletal system and the nervous system that maybe are weakened due to, I think you touched upon several issues that could cause this. And it's so common, more common than what many people don't understand because they're not hearing it on TV every day, or it's not, thrown in our face like some other conditions are. Doesn't make it any less common. And so I just appreciate the opportunity to work with you and your company, because I know the top quality of the product, and your passion for this is what really made me go with you rather than one of the other competitors. And your dedication to making sure that we're getting the best treatment and best support possible is something that I want everyone to know. That's what you're getting, with us in the Restore chair. Mark, I really thank you for your time. I know that you have a full schedule today. Taking the time out to educate us, bring awareness to this, and more importantly, hope to those suffering. So, again, looking forward to working with you guys, looking forward to changing lives in this area here. And really, really excited. If there's anything that you want to end with, any words of encouragement, floor is yours. If not, again, thank you so much.
Yeah, Dr. Newman, thank you. Thank you for your business support, but most of all, thank you for offering this treatment to your patients and to your future patients, because this truly is something that just about anybody over 40, men and women, have the issues. They can use this treatment, and they may not even know they have the issue until they try the treatment, and it truly is life-changing. And I'm just thankful there's guys like you out there who realize the need and are willing to move forward and start offering this type of treatment. So thank you.
Yeah, absolutely. My pleasure. Well, always good to talk to you, my friend. And we'll look forward to reconnecting in the near future, but have a great rest of your day. And thanks for your time.
Thank you. I'm looking forward to your success stories. Thank you.
Absolutely.
All right. Take care.
All right.